Coming up on American Medicine Today, what we eat affects our brain health, but what food should we be consuming? Dr. David and Melissa Bernstein share some answers from their latest book, The Power of Five. Next, Kenny spent decades with lower back pain attempting conservative treatments with no relief. Hear how the exclusive Bonati Spine Procedures finally eliminated his pain. Plus, Dr. Bonati discusses the perceptions and obstacles he's had to overcome in both the public and healthcare industry in order to become the world leader in spine surgery. Find out what hoops innovators are forced to jump through. Coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. What we eat is closely tied to our brain. So what should we be consuming to help us think better? Joining us to discuss is Dr. David Bernstein and his wife, Melissa Bernstein, co-authors of multiple books, including The Power of Five, the ultimate formula for longevity and remaining youthful. Welcome to the show.
Thank you.
Thank you very much. Yeah, we're glad to be here.
Dr. David Bernstein, why don't we just jump right in and get to that Power of Five? Why don't you tell us why sweets, sweat, stress, sleep, and socializing are so important to our overall health?
Well, I practiced medicine and geriatrics for 40 years. Mm-hmm. And what I observed is the thing that caused us to age the most, particularly our hearts and our brains, was inflammation. And what happens with older adults is their biggest fear is getting dementia. So I came up with a formula. I made it easy. I covered just 5 items, and it's avoid sweets, avoid stress, get more sleep, sweat, and socialization. And science has proven that every one of those contributes, when done right, contributes to a better health, better longevity. And so I combine that with a formula of exactly what to do with each of those, particularly exercise, which reduces inflammation, meditation that reduces stress. I talk a lot about sleep because it's so important. And I talk about socialization. And we know that socialization is akin to intimacy and connections, but the opposite of that is loneliness, which is a health hazard. I then allowed my wife, or encouraged my wife, Melissa, who is the greatest chef in the world, to come up with attributes to avoiding sweets, which is my euphemism for eating lifestyle.
So I developed the Power of Five test kitchen, which is where all the magic happens with cooking and eating. Your guide to healthy cooking and eating. And what I've done is taken all of the Power of Five sweets aspect and developed recipes that are good for our body and our brain. And we all know that food is very powerful and food is medicine.
Yes.
And so I've taken that one step beyond and looked at all of my recipes in the development and follow the Power of Five formula and help to guide people who don't really understand about what healthy cooking or healthy eating is, and steps them through how to become healthier, and just taking small recipes and starting small and building from there.
Can we have a sneak peek into what maybe one of those things would be?
We've discussed the ill effects of sugar many, many times on this program, and it's one of the hardest things to avoid because it's in virtually everything, even, off the shelf bread, there's sugar in it.
Absolutely.
So as Kimberly said, share some of these secrets of how can we get that kick of sweet and avoid the sugar.
Yes, you are absolutely correct. There is sugar in everything. So one of the things that I focus on is eating very healthy and eating clean, meaning that you're not eating anything processed. And you are reading labels. That is really important. Just like you said, there's sugar in everything. So you need to understand what really is sugar, because sugar has many names. So you have to understand what those are and be able to look for those in your, when you buy bread or when you buy any type of boxed or processed foods.
Is sugar, which is fructose, sucrose, and all these additives.
Right.
It really is addicting. And you probably talked on your programs about its effect on dopamine and pleasure. Yes. So people get a sense of pleasure from their food and needs to, quote, kick that addiction and move over to less processed foods and more whole foods. So we talk a lot about whole foods. And so if you use an example of an apple is sweet and it does have natural sugar in it, but it's surrounded by fiber and pectin and other substances which allow for a slower release or absorption of sugar, which then doesn't fit into that craving addiction to sugar. And science has proven that it's that sugar component that is really involved in vascular disease, heart disease, cancer, and so forth. So adding that and forming the somewhat, commercialized in terms of my Power of 5 formula, when you exercise and sleep right, for example, and are less stressed, the cravings for sweets will reduce as well. So that's an important component of how you break that dependency or craving for sugar.
Now, some people think just because they've turned to sweeteners that now they're being healthy and using diet drinks, now they're healthy. Isn't that actually worse?
Yes. In unison, we agree on something today. But it triggers the same reaction in your body. Hey, there's something sweet coming in. Right. Let's release some insulin. Yes. And 2 hours later, you have more insulin than you need, and you have a craving to eat. Right. So those people who have a bagel for breakfast at 8 o'clock, at 10 o'clock, they're looking for a donut because their blood sugar levels are dropping. So one has to really tame that. Right. And what we put together in Melissa and our formula are things that will be absorbed slowly, will be high enough in carbohydrates to fuel energy, but have enough protein and reduction in sweets and sugar part that makes it favorable.
We're also reading that you say we should be eating certain condiments normally found on hot dogs. So why don't you tell us more about that?
Normally found on hot dogs.
You wrote that?
I did.
Okay. So
my hot dog happens to be a carrot hot dog that I make. That's a recipe. You never believe how a carrot roasted looks just like a hot dog.
Doesn't taste like one, I'm sure.
Sounds good. I'm dying over here.
You got to check that in my cookbook on the hot dog that's made of a carrot.
I think you might be referring to the fact that some condiments do have sugar in them, like ketchup, but you can find ketchups that have no sugar added. Right. And that's where you get back to Melissa saying reading the labels. Mustard has some calories, but it doesn't have sugar and doesn't have a carbohydrate to add to that.
There's a section about the importance of using at least different kinds of herbs and spices in your food when you're cooking, such as cinnamon, as Dr. B recommended or mentioned. It helps to lower your blood pressure. There are other things that are also in line with reducing inflammation and providing antioxidants.
Like turmeric.
Turmeric is another one. We always get the turmeric question when we do presentations because people like to talk about turmeric. But turmeric in combination with pepper provides the best benefits to your diet, and that does help to reduce inflammation.
And promote longevity, which is all about what we're really all about.
When you're talking pepper, are you talking about cayenne pepper? Because you talk about, sweat. So
yeah.
Well, sweat is my euphemism for exercise.
Oh,
okay. And we do. Melissa does use cayenne pepper, but it's just straight black pepper. Helps absorption of turmeric.
Typically, if we need protein in our diet, obviously we think about having a steak or any kind of meat to get protein. But you guys are saying that we can get a lot of our protein from vegetables. If you can briefly explain that.
Yes. Do you know what the highest vegetable that has the highest level of protein in it?
I do not.
Anyone guess? Mushrooms.
Oh. Mushrooms.
Mushrooms have a high amount of protein in them, as do other vegetables. So you don't want to overcook mushrooms. You want to eat them raw, preferably in salads, which is a great way to get the full benefit from the protein in the mushrooms and all the other benefits that mushrooms provide for you.
But also legumes and nuts are really important in terms of combinations. So you get all the essential amino acids by making those combinations work for you, and you can do it.
All right. Well, thank you so much for both being on the program. Dr. David Bernstein and wife Melissa Bernstein, co-authors of multiple books, including Power of 5, The Ultimate Formula for Longevity and Remaining Youthful. Thank you for sharing your insight on keeping us all our best selves.
very welcome.
It's been our pleasure.
Make sure you stay tuned. Coming up after the break, a story of recovery. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect 98.75% patient satisfaction. 75,000 procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Visit askbonati.com. Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. I would like to introduce to the program Kenny Owens from Houston, Texas. Thank you for joining us.
Thank you, Kimberly. I'm glad to be here.
Kenny, I met you in person when you were in town for your Bonati Spine Procedures. So again, thank you for sharing your story of recovery. But why don't you tell us how you came to be in pain?
Well, when I was 21 years old, I was doing squats and I herniated a disc, and I had on again, off again crippling back pain for 15 years. And I got pretty decrepit, and I finally got so crippled down that I could barely work.
Where were you feeling pain on your body, and how was it impacting your activities?
Well, basically, it was L5S1, and sure enough, Dr. Bonati showed me on the MRI how it was causing the problem. So, yeah, it meant that I was unable to work, and it was very problematic.
Did it affect you walking or strength if you were trying to climb stairs? I'm just trying to get you to elaborate, so if people are watching or listening, they can kind of see themselves if they're suffering in the same way that you did.
Well, I think perhaps my situation was, as long as I got worked on 8 to 10 times a month, I could at least function. But once it started flaring up, I was totally disabled and nobody could even work on me.
Why did you wait so long to seek treatment?
Well, because for 20 years, I got worked on 5 days a week, and I never had pain. I ran 2 marathons. It wasn't until I quit having the treatment on my back that it could put enough compression on the bones, compression on the disc and the nerve, that it finally it was just too much, and I couldn't bear it.
So you said that you watched Newsmax, you saw the program, and then you went to YouTube to check out all the Bonati Spine Institute videos, and then you made your decision to come in. So why don't you kind of walk us through that process? What was it like to call for an evaluation, a preliminary evaluation over the phone, and then when you were physically face-to-face with the doctor during the evaluation?
Well, it went very smooth. I called the phone number, and my advocate, she was very pleasant, very helpful. Dr. Bonati called me, and another doctor called me, talked to me about my situation. So when I went to the Bonati Spine Institute, it was just a beautiful place. I went in, and they had me fill out the paperwork. It was a very smooth process. Then I went over to get imaging. I was in for surgery the next day after. I was very surprised how well oiled the machine was, how everybody did such a professional job, how nice they were, how orderly everything went.
With the Bonati Spine Procedures, they use something called conscious IV sedation. So you're not put completely under, and you're interacting with the surgeon during the procedure. You are afforded a chance to watch your procedure and invite a loved one in with you. So why don't you explain what that experience was like for you?
Yes, I had a friend that came with me named Lisa, and she wanted to come in and see what was going to go on. Yep. And I knew from watching the videos and hearing the testimonials on American Medicine Today that I would have the opportunity, should I be conscious enough, to watch the videos. And sure enough, I could see what was going on, and my friend was kind of eagerly watching, and it was an amazing thing to see. Of course, I couldn't really tell exactly what was happening because there was a little bit of blood and some tools in the way, but it was still an amazing thing to see. Dr. Bonati, such a skilled technician.
Yes. What was that experience like? Even if you saw some blood and there were tools there, did it almost take you out of the moment and kind of alleviate any anxiety because you could actually see and hear and communicate?
Well, I didn't really have too much anxiety because I totally trusted Dr. Bonati. He was so warm and helpful when he's explaining to me what he wanted to do.
Yes.
I felt totally just surrendered to him and his confidence, and I had no anxiety. I was comfortable. It was actually joyful, I would say.
What was recovery like? Because obviously you have the small incisions, so you have that, but we're not talking about that pain. The agonizing pain that you felt, when did you feel it lift?
Well, I'd say from the moment of the surgery. Yes.
Lift the leg up.
Lift the leg up, Ken. Straight.
All the way.
All the way.
All in there. No pain here.
No pain anywhere.
No pain here.
No pain anywhere.
No pain in the butt.
No pain anywhere.
No pain here.
No pain anywhere.
Beautiful. All right.
As soon as I was in recovery, I noticed there was something that was freed up in my back. And as days went on and I could move around and twist around, I knew that something was different. So the first time I went running, now keep in mind before, if I would run 5 minutes, I would be so crippled I couldn't work for days and days. Wow. So in this case, I just cautiously jogged slowly. Everything went fine, and I kept repeating and repeating. Finally went to Memorial Park, which is the local place, 3.2 miles, ran around that. So I'm back. I'm so excited. I can't say enough good things about Dr. Bonati and his unique procedure.
If I can put you back in the recovery area, they get you up and walking immediately after surgery. What were those first steps like?
Well, I would say it was just a pleasant surprise. I wouldn't totally surprised because I watched so many videos.
Yes.
It was kind of just as expected, and a great joy to know that something had been done that's going to, I'm still in the youth of old age, and I got a lot of years ahead of me, and I wanted to make sure that, I wanted to get this taken care of while I had the chance. And then I went back to work in 5 days, no pain. I've been running again, and I can't express my gratitude.
Before they released you from the Bonati Spine Institute, were you told to wear any sort of brace?
Actually, I didn't have to wear any brace. My procedure went so well. I had no pain. It was amazing. I just remember, going over and thanking Dr. Bonati and asking, when can I go back to work? He said, as soon as you want. And I was kind of surprised, but on the day 5, I went back to work, and then I've never, I haven't looked back.
Fantastic. And it shouldn't be a surprise because we don't tell people to wear braces. So once you're up and walking and ambulating and you've regained your strength and gotten back in motion, that is that healing process. So thank you for sharing your story of recovery with us.
And thank you for having American Medicine Day. It changed my life.
Thank you, Kenny. That's Kenny Owens from Houston, Texas. Thank you for your miraculous story of recovery. Now, if you or anyone you know is suffering just like Kenny, you can head over to the Bonati Spine Institute on YouTube. And if you want to find out if you're a candidate, visit askbonati.com. Stay tuned. We'll have more after the break.
I think everybody was shocked, like, really? You had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
That afternoon, when it was done, I actually felt so much better already.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, So 6 days, and everybody wasn't all like, "Didn't you just get out of surgery?" I'm like, "Yeah, I feel great." And like, "Okay, let's see how you do." And I was rolling with everybody, and I'm in the advanced class, so that sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. I'm Kimberly Bonati alongside world-renowned orthopedic surgeon Dr. Alfred Bonati. So, Doc, you wanted to tackle the struggles of the public perception from both patient and industry perspectives. Not only with the results you achieved with your patented procedures, but, issues you face with trying to grow the practice within the medical community. Can you elaborate?
To be able to be recognized what we do, they need to be a forum. And the forum needs to be created by the patients that we treated and the medical community who is under the observation of what we do.
Yes.
And the regulatory systems that sometimes they work to benefit us and the people.
Mm-hmm.
Now, unfortunately, we don't have that type of a power. We try to create a system that we'll call patient satisfaction.
Yes.
And the patient satisfaction is so overwhelming that I have friends that they look at me and they say, you are drinking Kool-Aid. Because if I cannot fix this patient, what do you think you can do better than I? And that is the competition between doctors. Every doctor who's going to operate the patients needs to think that he's the best. Well, the thing that is happening right now, this technique is going to be under scrutiny for the next 5 years.
Do you think so, even though you have 98.75% patient-reported satisfaction?
Yeah, but unless we start to publish and we start to show an independent type of a system that create that number, it's going to be always a disbelief.
So basically what you're doing and working with Wake Forest University is to really distinguish and confirm our procedure's success rate. That's what you're referring to, right? The 98.75% of patient-reported satisfaction?
That's correct.
The one that they told us overwhelmingly has already exceeded what they considered to be effective?
Yeah. The only problem is this needs to be in the journals. And unfortunately, through all my life, I just enjoy medicine. I don't like to write things. But remember, I'm the first individual in Florida, not in Florida, probably in the world, that put the scope in the shoulder.
Yes.
And then companies copy my techniques. And today is a multi-billion-dollar product all over the world. I never was recognized. The spine is a very special animal.
Yes, it is.
Because not only you can have problems in the shoulder and you can survive. You can have problems on the spine and you do have a real problem there.
You do, and you can survive, but you won't be really living to your fullest potential.
And the fact that we can treat the patient and return the patient in 2 or 3 days to a normal health that has no situation like that, sometimes for years and sometimes in a wheelchair.
Yes.
So if we can do that, I understand that people would not believe it. So I try to invite the regulatory systems to come over and see the surgeries.
Right.
In the beginning, they said, we don't do that.
Right.
Tried to invite the Board of Medicine to the surgeries several years ago. Right. They said, we don't do that.
Why?
So, but they say, we don't do that. But then they criticize what you do. That means you really deny the facts, but you get some type of a gotcha.
Correct.
All right. And that, to me, is very, very poor taste. Because I am a very passive individual. But don't tickle me because I can become a little mad.
Yeah.
And the major trouble with individuals that they are practically in a position of control makes me feel that the freedom to practice medicine is being affected. And if it is affected, I want to know why these people who control that, they are not seeing the results of this treatment. Why they are not coming and telling us how great we are.
Okay.
And instead of that, they go, well, we don't believe in it.
Right? Doesn't that seem a little bit odd? So they want you to remain in the dark, and basically they have no want for you to understand technology and the benefit that's giving results to the patients.
I think you are right in that. I think it's something more important today in the country. I think today in the country there are three elements that they are failing. One element is education. So the Department of Education needs to be revamped. Is indoctrinated kids, indoctrinating the media, indoctrinating the people with bad type of education.
Is that because they're always trying to promote devices and what you need instead of real resolutions to pain? And it's that kind of industry, almost like we say big pharma or the inventors of the products, that are kind of feeding the system and making it work in that direction. And you really think it's throwing a monkey wrench into everything when you said we don't need any of these tools and you just need to decompress and allow nerves to move through? And you take a direct approach, right? You don't try to access by going through the front.
So there are departments that they are compromised with socialism. The Department of Health control the health. And we know now the damage that healthcare control by NIH and by the individuals that they practically market the vaccinations and
Sure.
they practically
The
they destroy
WHO, the CDC.
Practically they destroy the healthcare and they destroy the economy of the country. That is one department that is managed. And we need to start to see who managed that department and why that people has the credentials to manage that department.
Well, between officials in these departments' lack of educational knowledge in the industry, there are certainly a lot of hurdles to jump when attempting to grow a practice that fights traditional medicine. Thank you for joining us on American Medicine Today. Check us out next Saturday, 4 p.m. Eastern on Newsmax, and check us out anytime on YouTube. Visit American Medicine Today. If you have any comments or questions, contact us at the number below. You can tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.